What causes rectal bleeding to come back after treatment? Imagine experiencing rectal bleeding and thinking the problem is gone, only to find it returns later. Understanding why this happens can help you stay alert and seek proper care. Rectal bleeding can come back after treatment for several reasons, often related to the original cause or how well the healing process went. One common reason is persistent or recurrent hemorrhoids. These swollen veins in the rectum or anus can bleed repeatedly if the factors that cause them, like constipation or straining, are not managed. If you continue to push hard during bowel movements or sit for long periods, hemorrhoids may not fully heal and can bleed again. Another cause is incomplete healing of anal fissures. These small tears in the lining of the anus can cause bleeding and pain. If the fissure does not heal properly due to ongoing trauma from hard stools or diarrhea, bleeding might persist or return even after initial treatment. Chronic inflammatory conditions like ulcerative colitis, Crohn's disease, or Proctitis also play a role. These diseases cause ongoing inflammation and ulceration in the colon or rectum. Even with treatment, they can flare up again, leading to recurrent bleeding. Managing these conditions often requires ongoing medication and monitoring. Polyps in the colon or rectum are growths that can bleed. If polyps are not completely removed during a procedure, or if new polyps develop, bleeding can happen again. Similarly, untreated or recurrent colorectal cancer can cause persistent bleeding, making regular screenings essential for high-risk individuals. Diverticulosis, which involves small pouches in the colon wall, and angiodysplasia, or abnormal blood vessels, can also cause intermittent bleeding that might recur after treatment. These conditions often requiring careful management and sometimes repeated procedures. In some cases, radiation therapy for pelvic cancers can lead to radiation-induced proctitis. This inflammation of the rectum may cause chronic or recurrent bleeding even months or years after treatment. Infections or repeated trauma to the rectal area can also cause inflammation and bleeding that may not fully resolve unless the cause is addressed. Sometimes, the initial treatment may not be enough if the underlying problem persists or if lifestyle changes are not followed. It's also important to consider that new or additional problems can develop after treatment. New polyps, inflammatory changes, or other lesions can cause fresh bleeding episodes. From a health perspective, recurrent rectal bleeding always warrants a thorough medical evaluation. It's crucial to rule out serious conditions like colorectal cancer or precancerous polyps. If bleeding continues or worsens, a healthcare professional may recommend procedures like colonoscopy to identify and treat the cause properly. To help reduce the chances of bleeding returning, managing constipation with a high-fiber diet and staying well hydrated is helpful. Avoiding straining during bowel movements, treating underlying inflammatory bowel diseases, and keeping up with regular screenings are also important steps. If you experience recurrent rectal bleeding, don't delay seeking medical advice. Early diagnosis and proper management can prevent complications like anemia or the progression of underlying diseases. Remember, each person's situation is unique, so personalized medical care is essential for the best outcomes.